Oh, I dealt with a nasty wound today. It was big and scary, just like the pictures of big and scary ones. Ooh, I'm just glad to be done. Good morning, guys. It's 5:40 in the morning and pretty pink sky out because the sun is rising. Anyways, this is my last clinical for the first term. I am almost a quarter of the way done. I had so much stuff to turn in this weekend. Oh my god, the last thing turned in at like 9:40 last night, I think, for last week. I haven't even looked at this week's assignments. I know some other people have, and I know there's at least one that's but I know there's no health assessment videos. I know I have 2 exams this week, and I know that in 2 weeks I get my 2-week break. And I feel like there is a break between summer and fall, but it's so insignificant time-wise that I don't think I'm going to feel like it's enough of a break at all. Like, I wouldn't be surprised if they open up the fall classes for us to see as soon as summer break is over and like get a head start. I don't know if they will or not, but yeah. Anyways, 2 weeks till my break, and then it will be a lot more clinicals for summer. Summer I have, I think, 80 plus 67, so that's 157. I have like 3 times as many clinical hours to do over the summer. So I'll be going somewhere about twice a week for 12-hour shifts, hopefully, which means Pana needs to get a lot busier, because when they're slow, understandably, they want to send me home because there's no one to chart on. But I hate hoping someone's in the hospital, but hope someone's in the hospital today. Yeah, it's not good. I only got about 5 hours of sleep last night because we had night nursing, which is so great. We used to not want night nursing. Raylan varies how much help she needs at night, but a lot of times it's not much at all. But gradually that's creeped up, and we've got used to it. We don't want night nursing, it's not that much, and then sometimes it's a lot, and it was just getting more and more often. And now, you know what, she had a good night last night. She didn't need much last night at all, I'm pretty sure. But we just sleep better, man. You can shut the door, first off. Your room gets so much darker when you can shut your door, not like be on alert, so for beeps. Anyways, we got good sleep. But night nursing, it's like, oh, we're gonna get great sleep and we can shut our door. We stayed up and watched a movie, you guys. I didn't go to bed till almost midnight. It was a good movie. It wasn't a good movie. It was a Munchausen by proxy movie. Not deep characters. It was like Lifetime or Hallmark made it, you know, but it kept my interest. But I've always found Munchausen by proxy, you know, morbidly fascinating anyways. So yeah, I didn't get a lot of sleep, but I only have 8.5 hour shift today, because this is to make up for the 2 times I went home early for lack of patience. So I can get a nap this afternoon, maybe. But like I said, I need to see what schoolwork is coming up and get started on this week's. Everyone in the house has asked me, except for Raylan, when are you going to the store next? So obviously I need to go to the store with their list of things. We'll see. Right now, hopefully, we have some sick people at the hospital, because I'm almost there. I'm in this little bitty town of Pana, Illinois now. These little towns are something else. Let's see what's playing at the theater. The Bad Guys. There's only one movie that plays in the theater in this little bitty town, because it's a little bitty theater. And it's a really old theater. Like, I feel like you've stepped back in time when you're in it a little bit. Anyways, I'm just rambling and giving Chris stuff to cut out. So, talk to you guys later.
9 hours later.
Done with first semester clinicals. And I wish I was done with Med Surg, but I'm not. I have 67 hours more to do. It will start on May 30th. That's the first day I can be back for second term. And I got a 12-hour shift scheduled for May 30th. And then by then they'll have the June schedule, and I can hopefully figure out when I'm gonna get those 67 hours in. Unfortunately, or fortunately, I don't know, my preceptor is going on vacation for a little over a week, but it overlaps with time that I was planning on being out of town anyways, so I wasn't going to be able to do clinicals those days. At least it overlaps. So, because 67 hours, I only have 3 weeks to do them. I might have to work almost every shift. Not every shift she was working, but more than half. I don't know. I'll have to look at how long I have to do those hours. It's a bumpy road, isn't it? How long I have to do those hours and when she's free. And when I'm free, I have a feeling I'm going to be asking off work for my ESL students to get those hours in on whatever day she works. Maybe I can check with her when she gets her June schedule so I know further in advance. Not a fun day to me. There were 2 clients that were, well, there was 3 inpatients, and I think 2 different outpatients came in, but I really wasn't involved at all with their stuff. I probably could have charted on any of the 3 inpatients. They were all sort of interesting and had enough stuff with them and were friendly enough. One was a little too friendly, but I think I got the most interesting one to chart, and thankfully I think she had the least number of meds too. Like, that's the most stuff we have to write about, every single medication when we're doing our logbook afterwards. There's a lot to write about every single medication, and she actually had probably the least medications of all of them. I'm just glad to be done. I don't love Med Surg. The more I do it, the more I don't love it. I understand why people say it's the quickest way to learn a lot. We'll see. I think mental health or case management, I did shadow a little bit the case management nurse. She came in to talk to the main patient that I was taking notes on. Case management definitely seems more up my alley, and even like experience wise, because I've done case management before I had kiddos, and after our oldest was born I did case management for a while with at-risk youth and children that had psychiatric services, both inpatient and in-home. I did case management for them, and then sometimes with Raylan I'm basically doing case management. So I don't know what clinical would cover case management. Maybe community health, maybe. But oh, I dealt with a nasty wound today. Like, it was big. It was big and scary, just like the pictures of big and scary ones. It was not a pressure ulcer. It was like necrotizing fasciitis in her breast. It looked bad, and it didn't make me feel woozy. It didn't bother me really to look at it. It looked a lot like the pictures. I didn't notice an odor, and I personally didn't have to clean it or pack it. I watched them pack it, and it had a 7-centimeter tunneling. I think I would have been freaking out if I had to stick that Q-tip in that wound to measure the tunneling. I don't have the steadiest hands. And it's not about, I mean, if I'm nervous, my hands would shake more, but it's not even about being nervous. I just don't have the steadiest hands anyways. And then I think if I had to stick one of them long Q-tip things in there to measure tunneling, I would be nervous. Ooh, I don't think that's for me. But it didn't gross me out. Like, I didn't mind standing there and helping her. You know, everything needs to be sterile, so I kept the sterile gloves and handed her things. I didn't mind helping, but I don't think that lady would have wanted me packing it. And I definitely was glad I wasn't the one packing her wound. I don't know. If it was the same person every day, like the same wound every day, where I knew what to expect, probably would make me less nervous, you know, but ooh, that's something else, man. Before nursing school, I guess I didn't even realize people had wounds that were open like that and look like that. Yeah. If that wound was on my breast, I would just be like, remove the whole thing, please. I'm not sure what's gonna happen with hers, but I definitely would right away be like, I don't need this whole entire breast. If there's a wound that big on it, just take it off, because I can't imagine. It would have to heal from the inside out. I think it would take forever. I mean, you don't need, yeah, that's just the easiest way to deal with that, and safest way to deal with that. Probably least painful way to deal with that. Yep, saw my first real wound. I feel like that was pretty bad looking. Now, it wasn't actively bleeding though. Gushing blood, active bleeding wounds, like, and it hurt her, but like these wounds, you know, it's not like an acute injury that, like, I don't know. I still think there's wounds I could see that would make me pass out, possibly, and injuries I could see that would make me get lightheaded and pass out. But this one definitely didn't. It just, And poop odors, I dealt with poop odors fine 2 shifts ago. Some poop odors today. I think I did fine not showing disgust on my face, and I didn't like gag or anything, but I did not feel like mentally I was dealing as well with the poop odors today. And guys, I'm not saying this to complain. I think that it's fine that I know that big wounds and poop odors are maybe not for me. Nursing's such a diverse field, and there's so many different nursing jobs. Like the nurse case manager, she doesn't pack wounds, she doesn't wipe butts. She makes a lot of phone calls, she fills out a lot of paperwork, she has to understand what's going on medically with someone. But in mental health, they deal with totally different issues. They deal with probably some of the bedside manner I dealt with today, which was not the most polite bedside manner from a patient. Is it bedside manner if it's from the patient? Maybe that's only from the provider. Their manners were not very nice. Or appropriate. Appropriate is probably the better word. Their manners were not very appropriate. The comments they made, and some of the questions they asked us were definitely not appropriate. That's probably what you deal with more in mental health. Because that was the first patient they've had on the floor that I've been like, you need to think about what you're saying. And I would expect that a lot more with mental health. But that doesn't really get to me as much as like gross stuff. Oh, sputum. I saw some sputum today that I had to quickly just stop thinking about it, or I would have probably retched. Yeah. So guys, didn't deal with the poop smell the best today. Some sputum. Honestly, like, I just don't want to think about this stuff right now. I'm kind of making my stomach churn talking about it. I can get through 67 more hours of Med Surg. I can do it. I can do it, and like I said, I think I was professional all day. I think I was helpful all day, even in gross situations. I didn't, like, gag or pass out or get dizzy, and I kept my headache away. I got the right amount of caffeine and breaks when I needed them. I can deal with all that gross stuff, but there's other stuff I'd rather do than that as a nurse. There's other nursing jobs I think I would like more, and that's okay. I got a lot more of this to do before I'm done with that and can find the nursing job that's more for me. And again, like, if it's the same person every day, I feel like it's a little bit different when it's like home health, there's different kinds of home health. Not home health where you go visit a million different people, but like private duty nursing, where it's the same client every day. If you're dealing with the same wound every day or the same person, to me it seems a little easier than just random people's bodily fluids and stuff. I don't know though. We will see. I wasn't sure I'd be able to handle the wound thing I saw today, and it was fine. Like I said, from a couple feet away and just handing stuff. I wasn't like up close and personal with that wound. I'm just rambling though. That was my day. That was my day. I don't know anything else. Probably should